And now, World Sickle Cell Day is a national awareness campaign set to be carried out every 19th of June. The goal to increase public knowledge and an understanding of sickle cell disease and the challenges experienced by patients. In view of this, our correspondent met with a medical practitioner who spoke on the issues as sickle cell patients experience and how this day is expected to help society.
World Sickle Day is a national awareness campaign to celebrate Sickle Cell Day with the goal to increase public knowledge and an understanding of sickle cell disease and the challenges experienced by patients. This is a disease caused mostly by a group of inherited red blood cell disorder which are round and move through blood vessels to carry oxygen throughout. The red blood cell becomes hard, sticky, and looks like a C shape, which leads to constant storage of red blood cells.
Sickle cell disease is an inherited blood disorder, which is really caused by mutation in the gene, causing production of abnormal hemoglobin. You see, the normal hemoglobin, which we call the A, is biconcave and very flexible. But in the case of sickle, that's where the names come from. It's like a sickle. That's the instrument used to pluck, if you know that. So it's just sickle. Apart from that change in shape, it's also very rigid. So, and that's what happens when they start to have their complaints. You know, it's a mutation, so we don't know particularly the cause. We know that it's inherited. And so what happens technically is this: if you are AS and you are married to AS, that means you have two of those genes. You have A, which is normal, you have S, which is abnormal. And so when two AS, for example, marries, they have probability of having AA, of having SS, of having SS, having AA, AS, and SS. So all those possibilities are there. So once someone in the family has the abnormal gene, then if two of those abnormal genes is transmitted to that child, then that child will be a sickle cell disease patient.
Presently in Nigeria, sickle cell patients are being treated specially with tender loving care to make them feel loved among the society.
Yes. You know, early, they are treated by the pediatrician. Those are the specialist doctor for young children. You know, apart from being a pediatrician, they have what they call pediatrician hematologist. Apart from being doctor of children, let me put it like that, they also specializes in blood and blood diseases. So that's pediatrician, pediatric hematology. But as they grow older, they see the hematologist, which that's the woman that takes care of the adult. But naturally, for sickle cell patients, they need TLC. Simple. You should know the meaning of TLC. TLC is tender loving care. They are special, and so they should be treated like special beings. And currently, there are even better drugs that allows them. You know, they have two states. They have the steady state and the crisis state. It's during the crisis state that you probably know they are sickle cell patient. Probably they majorly have what we call pain, bone pain crisis, which we call vaso-occlusive crisis. But apart from that, outside that, they are virtually okay, virtually normal. So once they are properly managed, they will be in more of the steady state, not having problem than in the crisis state. And there are drugs that assists a lot. And of course, there's also a known cure now. Relationship, do genetic counseling. It is preferable that those with sickle cell trait, that's those with AS or AC, don't marry. It's preferable. And so with that, we are going to reduce the burden of sickle cell disease. And also, we also know that there's also possibility of diagnosing the genotype of the baby while the baby is still inside the womb. Now, the question is this. If you diagnose that baby to be sickle cell in utero, what will you do? You are going to abort? Is abortion legal in Nigeria? No, as at today. So that's legal aspect. Now, apart from that, if you have a child with sickle cell disorder, know that that child is special and needs special care. They are not the kind of children that have complaint, have headache, fever, that you'll be treating yourself. You need to take to the doctor straight away so that they investigate if they need to, because they need to quickly treat. Mind you, their PCV is almost always low. And so little insult will lead them to severe anemia that they will need blood for. So they are special and they must be taken like that. They need to avoid extreme of temperature, drink a lot of water, and there must be malaria prophylaxis. One of the things giving them crisis is malaria. And so regularly they are placed on some drug to prevent them from having malaria.
It is a candid advice for parents to consider their genotypes and of their partners to reduce the numbers of sickle cell in the society, while all concerned patients be treated with TLC measures.